The health authorities here say the number of patients with respiratory diseases and other viruses has been surging because more people take their masks off these days. Now they are putting proactive emergency measures in place earlier than originally planned. Lee Soo-jin reports.
The relief that people felt after being able to take their masks off following the decline in COVID-19 infections will seemingly be short-lived as other viruses have begun to spread nationwide. Data released by the National Health Insurance Service on Friday showed that the number of influenza patients saw a whopping 91.2-fold rise in 2022 compared to the previous year. Cases of influenza have been steadily decreasing since 2018, but saw a sharp rise in 2022. Teenagers were the most commonly affected, making up nearly 40% of patients, as group activities in schools and academies more easily expose them to viruses, leading to a more rapid spread of infectious diseases. This upward trend is continuing as patients with acute respiratory infections have also risen to 461 in the second week of January this year from 368 in the 51st week of last year. But it's not just respiratory illnesses that are plaguing the nation. During the second week of January, 360 people were infected with norovirus, a highly contagious stomach bug that causes vomiting and diarrhea, according to the Korea Disease Control and Prevention Agency. That's the highest weekly infection count in 5 years. Even more concerning is that children and infants between the ages of 0 and 6 made up nearly half of the individuals infected. And considering how norovirus infections are typically most prevalent between the third week of January and the fourth week of February, the patient count is unlikely to go down anytime soon. To combat this upward trend of both influenza and norovirus cases, the health authorities have decided to take preemptive measures. The KDC announced that it will implement emergency quarantine measures starting Friday instead of during the Lunar New Year holiday from February 9th to the 12th as originally scheduled. The agency and health institutions nationwide will ensure assistance lines and reporting service systems are ready before the holiday alongside 24-hour emergency helplines. Local healthcare institutions, pharmacies, childcare facilities, and kindergartens will also receive guidelines on how to prevent and report the spread of viruses. Lee Soo-jin, Arirang News.